Rural hospitals in our state are struggling to get enough funding and staff doctors and nurses. New this morning, state lawmakers are now trying to help.
That's right. 9 News reporter Anusha Roy joins us now live outside the state capitol. Anusha, this has been a long-standing issue, and hospitals say help can't come soon enough.
Hey, good morning, Corey and Jordan. Yeah, the folks I talked to said at least they're feeling a little bit more seen with this bill. It is still waiting on the governor's signature. If that ultimately does happen, it would be infusing $800,000 into this program, specifically to expand a rural workforce initiative that is run through CU School of Medicine. When you look at some of the latest statistics from the Rural Health Center, it shows that 77% of Colorado is considered rural or frontier. So that means around 700,000 people are living in these areas where they are relying on the healthcare for these rural hospitals for huge chunks of Colorado. And it's not only that, these are also economic engines for these communities. And yet the Colorado Hospital Association says that a majority of our rural hospitals, we are talking 85%, are not operating within a sustainable operating margin. And that's why they're saying it's so important to build out a system that is focusing specifically on people who want to work in rural Colorado.
It means that our rural communities have poorer health outcomes. This truly is an equity issue at the end of the day, because you're talking about folks who don't have the same access to healthcare services that we might along the Front Range or in our larger communities of the state.
So I also had a chat with the CEO of Lincoln Hospital that's out in Hugo, and he was saying how important it is to find the right fit for these hospitals. You know, for them, it's a very different lifestyle. The closest Walmart is 85 miles away. They have to make sure that they're offering the right incentives, that it's not only working for nurses and doctors, but their entire families as well. And that is why he's so supportive of any kind of financial boost to a program that's really focused on people who are from rural Colorado who are interested in coming back to rural Colorado as healthcare workers. Reporting live in Denver, Anusha Roy, 9 News.
Yeah, we've heard from a lot of people in areas like that say help like that, what you just described, is incredibly needed. All right, Anusha.